By Dr. Geoffrey Mount, MD, a Harvard-educated Master of Public Health, author and board-certified doctor in Washington, D.C. Dr. Geoffrey has worked on the front lines of some of the nation's most urgent public health crises, including COVID-19, Ebola, and the H1N1. Throughout the COVID-19 pandemic, he gave hundreds of expert interviews and served as an advisor to multiple government committees. Why does this matter? Because when it comes to your health, you don't have time for trial and error. By choosing Shield vitamins, you'll tap into Dr. Geoffrey's vast specialized expertise to invigorate your wellness and vitality all year round. Sankofa Speaks, help me welcome Dr. Geoffrey Mount to the show. Hey, Doc, how you doing today?
I'm doing well, Freddie, and how are you, brother?
I'm excellent. I'm excellent. Always good to have a conversation with you, good brother. We just did a little bit of your bio, a little bit of reading from your site. Can you tell us what's missing? What's missing from the conversation?
Let me back up. First of all, I love what you do. My family buys your products. We like really do. And I'm after this trip that I'm going to do with you coming up this summer, I should be at the top of that VIP list based upon the cost. And then the next thing I'm going for is I'm going to figure out a way I can do something so great where I am one of those pictures on your back wall.
Okay. I like it. I like it.
All right. Hey, everybody. I'm Dr. Geoffrey. I'm practicing emergency medicine physician. I'm a Hampton graduate. I am an alpha, and I have a vitamin company called Shield Vitamins. But most importantly, I'm a proud father, and my daughter's graduating from Hampton this year. And my son is a freshman at Hampton. He's the 9th one in the family to go to Hampton. Wow. And I positioned myself, I pivoted my company, and this is a good thing of like Trump. I pivoted my company. I used to speak about health. Now I'm uniquely focused on Black health. And I'm uniquely focused on Secretary Kennedy because of the stuff that he's doing, but we're going to win this thing no matter what. So Freddie, thank you very much for having me.
Yeah. All right. Now this is good because I didn't know this. All right. Now we're about to get some good stuff because I get to ask the questions I want to know.
My man.
All right. So you're focused intentionally on Black health. Yeah, I promise I didn't know this going into this. But why? What made you pivot into us?
Because it's always been so let me just back up. My first book was about teaching Black kids, Black boys to survive police encounters. That was in 2017 before it became popular. My point of saying that I've been loving on Black folks for a long time. And so when I entered into my business, it was about making money. So the way you make money is you include the most amount of people, Black folks and white folks. And that was cool, and I have both. But I decided that part of my passion and calling is to educate, protect, serve, and help Black folks, especially given what's going on with this current environment where I think often we are being misled. And let me be very clear. I'm a part of the system, so I'm not indicting the whole system, but I just feel as though making sure that we focus on Black health issues is key.
So, okay, one, you're in the right spot for this. We love that. But what's missing? What's missing in Black health? Where are we getting it wrong? That your intense focus on this particular people is needed.
Few things. I will be the first to admit, everybody, I'm clearly a Black male. I'm a Black male physician as well, but I've been a patient too. And what is clear is not he say, she say. Blacks are treated differently when they enter the healthcare system. Black males are treated the worst when they enter the healthcare system. And so when they talk about Black health outcomes, it's not just about how we're living, it's about how you're treating us. Now, how you treat us plays a role in whether or not we come back. And what a lot of people do not know, at least as it relates to like Black males, after you're 18, which you're no longer a pediatric patient, you actually have no reason to interact with the healthcare system again. So those that do, studies show we're treated differently, and it's in subtle ways. Let me tell you something very, very subtle. They looked at a big healthcare organization where everybody had access to the same number of like primary care doctors. Studies show that the Black males, A, they waited longer. 2, they were often had to see multiple primary care providers, meaning that they didn't build relationships. Whereas with Black females or all females, they have to go for their regular exams anywhere. So they're constantly involved in the healthcare system. But males, no, there's no reason for us to go regularly. Combine that with the system doesn't make us feel good.
Yeah, that's interesting because yeah, because the wife goes regularly and I don't, right? Or I haven't, at least in the past. I'm trying to change that, Doc. So don't get on
Please.
me. Don't get on me. But what I mean, I guess Black folks in general kind of got an adverse relationship with the doctor. Is that what you're still finding even today? Is that contributing to it, or is that just something
Well,
different?
I don't want to put that myth out there. I
Okay.
wouldn't say it's adverse. I would say that we have adverse experiences more common than our white peers. Do I as an ER doctor do I see my white colleagues um, purposely treat Black patients poorly? I don't think I've ever seen that.
Okay.
But there are subtle things that they like that they do to us, and they don't even recognize that they're doing it. So it's very important for me to highlight. I believe in the healthcare system. It's strong. It serves people well. It serves many Black folks well. It's just that when it falls short, it's most commonly on a Black person.
On a Black person. Okay. Okay. All right. So, all right, we know it falls a little short, right? And we know the administration and what they're in. What are some of the things that Black folks can do specifically to help ourselves in this area of health? We were having this conversation about generational wealth all the time. So now the conversation is kind of turning into generational health. So like, how can we help ourselves?
Oh, Freddie, you threw me a softball there. Whoa, I got a few different ways. So look, let's just start with women first. Let's talk with women. Prevention is key. And somebody's going to say, but I don't have insurance. Well, some prevention, if you go to your public health department, there are federal funds. Uh-oh, I said that. Well, there used to be federal funds for them that run through your public health department. There's 5 areas, women, 5 areas that it's very important for you to do. Number one, make sure you get your blood pressure checked. This is men and women. It's called a silent killer for a reason, which means you can have high blood pressure for years and it can be horrible, not have any symptoms. Next thing you know, you have a stroke, you have a heart attack. And by the way, 47% of Black women have hypertension and heart disease. Simply
Wow.
getting it checked. And you're gonna say, but I don't have time. Anytime you go to a grocery store that has a pharmacy, anytime you go to a pharmacy, you can get it checked for like free. Number two, the pap smear is key. Freddie, did you know that cervical cancer, which is what detects pap smears, it's 100% preventable. I mean, just by being vaccinated, it can be prevented. I get it. Everyone does not believe in vaccinations. But if you get a pap smear, they can pick it up early. And when they pick it up early, it's 94% curable. 94% curable. Let me just run through them. A mammogram, screening mammogram is extremely key. You may need to get an ultrasound. What we do know is that Black women and white women, they have about the same rates as breast cancer. However, Black women, they present later, although they get it at an earlier age. And what's most important, it's more aggressive. Making sure you get a screening colonoscopy. Why? And this applies to like men too. Real quick, I'm gonna slow this down because I need people to listen. This is very key. So, and it's gonna be less than a minute. Colon cancer has 4 stages: 1, 2, 3, and 4. If you catch in stage 1 or 2, where there's no symptoms, it's about 94 to 97% curable. No symptoms, stage 1 and 2. Stage 3 and 4, when you have symptoms, by the time you have symptoms of bloody diarrhea, stomach pain, you have about a 50-50 shot. And the only way to catch in stage 1 and 2 is a screening colonoscopy. And then you land, and then I will land my plane, making sure you get basic labs done, a CBC, a complete blood count, a complete metabolic panel, looks at your potassium and your sodium, and make sure you get a lipid profile. So for women, bam, you do those things. You have, I need y'all to listen to this stat. You do those, you decrease your risk of dying an early death by 88%. Well, those are odds that we would all bet on. 88% by getting those steps done. I'm not saying that none of them are going to be positive, but if you get them done regularly, things that are caught early are easier to cure.
Wow. Wow, that was great. Okay, 88%. Blood pressure, pap smear, mammogram, colonoscopy, basic labs. All right, now that was specific for Black women. Do you got anything specific for Black men?
Yes. So for women, I mean, for the men, it's the same thing with the exception of, I mean, obviously, you're not going to get a mammogram. Having said that, keep in mind, men, about 10 to 12% of women, of men do get breast cancer. So just keep that in mind. Now, men, this is the most important. I mean, so everything men, CBC, I mean, complete blood count, making sure you get your blood work, making sure that you get your blood pressure checked, making sure that you get your colonoscopy. All that is key. Oh, for women, I also forgot this one, stepping on a scale, checking your weight. For men, it's the same thing. But the other one, men, is making sure you get your PSA done, your prostatic specific antigen. That's your prostate. And I get it. That's a blood test. I get it. Many of you always say you don't want that finger in your rectum. If you choose not to do that part, I can live with that. I can live with that. But you have to get that blood test done because prostate cancer caught early, it has a better outcome. And Black males, when they get prostate cancer, it's usually younger and it's often more aggressive.
Um, okay, I missed the fifth one. I got blood
For
work, blood pressure, colonoscopy, PSA,
step on a scale.
scale.
Yeah, and by the way, everyone, the reason I say scale, it's a polite way of saying obesity. Obesity is tied to increased risk of cancer, increased risk of heart disease, increased risk of stroke, increased risk of diabetes. The list goes on.
Doc, you mentioned that, so I gotta pull us here. I want to ask about children next, but before we do, that increase of obesity, is obesity hereditary? Is that passed along?
Pause, because I'm just trying to figure out how to answer this. So the technical answer to your question is it hereditary? I mean, is there a genetic predisposition for it? The answer to that would be a yes. However, just because you have a gene does not mean it's going to be turned on. Meaning that environment can turn it on. Your environment is simple as this. If you have the obesity gene and you eat well and you don't smoke and you exercise, that gene may never be turned on. However, if you have that gene and you eat poorly, your environment can turn that gene on. So let me land my plane. People say, but it runs in my family. Yeah, it runs in your family, but you don't have to be obese.
Mm,
And I say that, people, humbly, because I recognize it's not easy. It's not easy, but that's the one thing we can control is what we put in our mouth.
right, right. Okay, like getting back to those five things, is there anything specific for children that we should be making? Is it just the regular checkups, or is there anything specific that we?
Oh, the regular checkups in children is extremely key. And given we just came off of autism month, and I've done a few talks about it. If you believe that your child is, let's just call it strange, and something is the matter, have your child tested. A new report just came out last month that said that more Black people, more Black children are being diagnosed with autism. So some people would say, "Ooh, we're like getting it more." No, this is the manifestation of public health issues, our public health focus for the last 10 to like 20 years. In other words, they put more services in underserved Black communities. So we're able to pick it up and diagnose it early. The problem with that is, and you heard me mention Secretary Kenny early, because he commented on it. He goes, "Hey, I believe it's environmental that we're picking up more cases. I believe the data may be wrong." And so now he wants to put more sources into environmental causes. Guess where those sources are going to come from? Those programs they put in Black communities. So all of a sudden, because autism used to be a white person's disease, so we thought. But now that we're seeing that that's not necessarily the case, and we know why the cases are increasing amongst Blacks, which is access to healthcare and testing for young Black children. Now, all of a sudden, that funding, it seems to be in question now.
Interesting. Yeah, so I'm glad you went into that because I was going to ask, like, what are some of the gripes against Kennedy and this Trump administration? Like, what are some of the things we should be concerned about?
Oh, I'm gonna stay off of Trump because that can be endless. But Kennedy, everyone just needs to keep in mind, he's not a physician. He's not a physician. He's done a few things. The first thing, this is very subtle. This is very subtle. He said, he appeared in front of Congress and said, Black folks have stronger immunities. Some people say, hey, that's great, all right, all right. It's not true. No one has said that. That has not been proven in any way. But now all of a sudden you have people thinking that, then all of a sudden you have people say, hey, they don't need to be vaccinated because they have stronger immunities. Next thing they're going to say is that they've got thicker skin, so they don't feel pain as well. And by the way, there was a study that was done that medical students 8 years ago were surveyed, and they thought that Black folks had thicker skin, and therefore they did not see more, they did not have as much pain. Back to Kenny, he does little subversive things that misleads people, especially as it relates to Black folks.
Interesting. Okay, so like, how do we protect ourselves? We just got to pay attention. That's the I guess regular interactions with our doctor and asking questions.
Regular interactions with your doctor is key. Living above a fence, living above a fence. Let me tell you what I mean by that. And this is for all people, all patients, Black and white. But I think that Blacks, we are on hyper alert because they've already have treated us poorly. Physicians as a whole, we have less time to spend with you. So if you're feeling rushed, obviously if you're feeling rushed in your ER, that's just what we do. We kind of rush you. But when you go to your primary care doctor, if you're feeling rushed, it's because the system is set up that they have less time with you. So don't take it personally, but do your homework before you come. Your homework can be as simple as, I'm gonna write down, I need to ask this, I need to ask about this, I need to ask about that. I would even encourage patients, if you need to do your own little search, ChatGPT is pretty good, WebMD, so that you can get to the next layer of questions that you ask your doctor.
Okay, I like that. Like going in the chat or WebMD and saying, hey, well, I'm this age, I got this background. Like what are the things that I should be concerned about? Or where should I ask my doctor to go deeper, which I'm assuming they will. But if you don't ask the questions.
It's a collaborative, everyone. It's a collaborative relationship. I'm gonna be careful about this. No, this is how I want to say it. Gone are the days where you solely rely on the doctor's notes and making sure they're doing the right thing. I would say that this is collaborative. You know, there are a bunch of lists, there are a bunch of services that like you can go to and say, at this checkup, what should he or she be checking? Or what are the consults that I may consider having them ask for? I mean, do I need to see a dermatologist? Boom, boom, boom. So this is a collaborative effort for all Americans.
Yeah. Oh, I like that a lot. Because my dad, he always tells me, you know, he keeps all of the notes, right, from all of his doctor visits, but he studies them, and he's like, yeah, you might be in the range, like in the safe range of whatever it is that he's looking at, but it's like I might be in, you know, I'm just gonna pick some numbers between 85 and 100, but I might be 95, right? Like I'm technically inside of the range, but I'm closer to trouble. So we want to kind of have those conversations, right? Like that's how we all should be.
Brady, that's an excellent point. And then let's go back to the PSA, to the PSA which I screens for prostate cancer. The normal range is 0 to 4, 0 to 4. If this year I'm a 1, but next year I'm a 4, let's say I'm a 3.9. There's a problem. I've gone up 3x as much. So that's a problem. So your father's absolutely right. Just because you're in a range, look at the rate of change and then look at how close you are to normal.
I like that rate of change. Yeah, like paying attention. The PSA, how often should we do these tests? Even all of them, like for the men and women, like how often should we do these tests? Is this a regular thing or is it like a one?
So for the men, a PSA is yearly. The current recommendation is 50. However, Black males, it should be 40. So, and you can push your primary care doctor, boom, 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 and the insurance charges you, although he should be able to write a letter for it, it'll be $20. But a colonoscopy is usually every 5 years. However, if your colonoscopy is completely normal, your doctor may push to like 10 years. I don't recommend that. And the other labs are yearly. Sitting on a scale is every couple months. Having your blood pressure checked is monthly. For the mammogram, I would highly talk to, I would encourage you to talk to your primary care doctor, because a lot of that depends on your family history and what they find. Now, for Black women, since Freddie went back to it, Black women's breasts are more dense. So often a mammogram is not as effective. So it's okay to say, hey, primary care doctor, I'm a Black woman. My breasts are more dense. Maybe we should get an ultrasound. So it's that type of collaborative effort, Freddie, and your primary care doctor may say, hey, good point. So I think that people expect a lot from their primary care doctor, as they should, but they're human too. And often I see that things are dropped through the cracks.
Yeah, I think what's really important about this conversation that you're giving for us today is we should be more collaborative with our doctor, right? And rather than just sitting there letting them tell us, it's like, hey, no, I'm an active participant in my health, and like let me be a part of this. And hey, did you check this or did you check that? I think it's good. I think it's good for us to hear from a doctor that it's okay to ask these questions. It's okay to say, hey, well, I heard this or I read about this. Can you explain this a little bit more? Kind of giving us permission to interact.
You have permission, but keep in mind, having said that, I still practice. And also, sometimes patients will come in like, I got a list of 12 things I need to ask you. I, I'm an ER doctor, so let me see the list and the ones that I can answer. Great, but it's not a physiology lesson. It's not physiology. But I do want to pivot to one other thing before we move on. The color of a doctor matters, and I'm not saying that because I'm Black. The color of a doctor matters, as evidenced by new an article published 2 years ago. It looked at maternal child death rates. For women, what we do know, they're 2 times highest for women, 2 times high for women, even once you adjust for education and income. What this study did, it said that if the OB-GYN is Black, the death rate goes down 50%.
Wow.
You hear me? Just by the provider being Black, it goes down 50%. So I said, while that was done about OB-GYN, I have not heard or read of anything about any other studies, but I reserve the right to speculate. And that is, I would bet if they do those same studies in other specialties, they will find similar numbers. And I just want to say, while I'm giving you this information, I still trust and rely on the healthcare industry. I'm simply arming you with another perspective.
Okay. So taking all of this in and, feeling, learning about Kennedy and the 5 things that we need to do as men and women and, regular checkups with our children and all of that, where does this gut health conversation and like your vitamins, where does this sit in that conversation? Why gut health? Why is this so important?
So the gut, because it sits in it because it's tied to everything that we talked about, everything. And let me tell you why. Because we basically have 3 nervous systems. I know we only think that we have 2. We have the central nervous system, the brain, and the spinal cord. We've got the autonomic nervous system that controls whether or not we blink, our heart rate, fight or flight. We know about those. But there's a third one that people don't really talk about. It's called the enteric nervous system. That's your gut. And believe it or not, while the brain is the leader and the autonomic is the manager, the gut is the rebel. Because the gut, it doesn't need to rely on the brain for anything. And so inside of the gut, you have 82% of your immune system. And so your immune system, it decreases inflammation. Because when there's inflammation, there's increased risk for cancer, there's increased risk for stroke, there's increased risk for heart disease, all things that we just talked about. So making sure your gut doesn't have inflammation. And by the way, 90% of the serotonin, that's a neurochemical that helps control our mood, helps us stay calm, helps us relax. 90% of those is in our gut. And so gut health is tied to everything. It is key, and it's new information, which is why you see all these prebiotics, probiotics, because now we understand that the gut is almost its own nervous system.
Wow. Okay. Hey, I hadn't heard anything like that. Okay. So 82% of the immune system is in the gut. So what we eat is even more important, right? And we know we're not doing like balanced diets or whatnot. Go ahead, brother. Jump in there. What do you think?
No, I was letting you talk, but since you
Oh
mentioned
yeah,
it,
I see
so
you got fired up. I was like,
because I didn't connect dots. So and if there are any healthcare people on there, I'm making this simple. So please don't get on saying I should have said such and such. So in other words, when we don't eat right, we get inflammation in our gut. When you get inflammation in your gut, it causes leakage from your gut into your bloodstream. So all of a sudden you get toxins and viruses that leak into your bloodstream and causes more inflammation. Everyone, don't forget what I said earlier. Inflammation is the precursor for heart disease, strokes, cancer. And so if you are not eating right, it messes up that lining of your stomach and causes inflammation elsewhere. And don't forget, 90% of that chemical serotonin that makes you feel good is located in your gut. You mess that up, you wonder why somebody's in a bad mood, not because they're hangry, it's because they've been eating bad.
wow. Wow. Now that's interesting. Angela says, I'm so grateful I'm on this particular Zoom meeting this morning. Yeah, that's good. That's good. Um, wow. Okay. Inflammation. So if we are being inflamed in our gut and our organs, are there any symptoms or is it just too late? Like, how can we
Oh,
tell, like, I need to get my eating together? Or do you just need to get your eating together?
you need to get your eating together, but there are symptoms. If bloating, abdominal pain, irregular bowels, moodiness, frequent infections, that could all be related to your gut. And one of the biggest things, I want to say biggest, a big one is if you don't get enough sleep. If you don't get enough sleep, it disrupts your gut biome. That means the normal bacteria in your gut. So you going to bed late, that disrupts your whole gut biome.
Hmm. Okay. So, wow. Okay. So all of this is kind of, not kind of, it is interconnected, right?
Yes.
So what are we missing, I guess, typically in our diets, like in our eating? I don't want to say diet, like, oh, I'm on a diet, like just the food and nutrition that we're taking in. What are we most commonly missing, I guess, that are leading to some of these issues?
First
And
one's
I would
hydration.
add, is this like a black issue? Is this a black thing or is it a regular thing?
Ooh, see, I'm very cautious about saying something is a black thing,
Okay.
but it has a black concentration to it because we all make our own up our own minds, but also because of the food markets that are in our communities. So it's a combination. But to your first question, hydration is where you start. Hydration is where you start. And I'm not talking about soda because soda causes gut inflammation. Just regular water. Some people say, well, it doesn't matter if it's alkaline or doesn't have it's spring. Doesn't matter. Regular pure water is just fine in making sure that you get 6 to 8 16-ounce bottles of water on a regular day. On a regular day. And the reason I say a regular day is because if it's hot outside, you obviously want to drink more. And if you're working out, you obviously want to drink more. And because keep in mind, one of the common symptoms of gastrointestinal problems is constipation. What's the most common cause of constipation? Dehydration. Let me give you a real example. Phrase, is it okay if I give you a like real example?
Please do.
All right. So for instance, remember you're on like vacation and you're going down, you're going down the waterfall, you're going down the canal on a boat. It's going nice and smooth, right? It's going nice smooth. That's good, right? You've got plenty of water going. So imagine if that canal doesn't have any, it has very little water in it. You hitting stuff, you're sluggish, it goes real slow. Same with your colon. If you're not well hydrated, it goes slow, it gets stuck, thus causing constipation. So that's
Mm.
why it's important to stay hydrated. It helps your immune system, it helps your gut, it helps everything.
That's interesting because I got friends and they don't drink water. And like they like brag about it, like, man, why I don't be drinking no water? And I'm thinking, like, that's the most ignorant thing. That's the most ignorant thing I've ever heard in my life. I don't drink water. Like, your body's mostly water. Why wouldn't you give it water, right? Like, that's interesting to me. But it just seems to be like I don't know. I don't know. Maybe it's just the environment I grew up in, right? Like, so let me stop. I'm gonna get like you, Doc. I ain't gonna just pin that on black folks. I'm gonna say that's my limited circle. Uh, and that's
But
definitely
you
not
got
all.
enough credibility where because of what you do, if you want to pin a few things, it's okay.
Yeah, I drink water like crazy, right? Like I get my 100 ounces. That's my goal every day, and I try to get to bed. I try to get my 7 to 8 hours
Oh, I
of rest
see.
as well every day, um, as well. Okay, so you mentioned with the water, you mentioned like it's not really necessary to have alkaline water. Like you hear this conversation a lot, and I want to expand it into foods, right? Because you got the Dr. Sebi conversation. Hey, you should be eating alkaline foods. This is the problem that with our community, we need more alkaline nutrition. What are your thoughts on that? I know it's not an all or nothing.
Right. I think that once you get your nutrition under control, then you can start teasing out, do you want alkaline? Do you want plant-based? Do you want vegetarian? Because an argument can be made. And anyone who has known me would be so surprised to hear me say this. And there's a strong argument that a plant-based diet is very reasonable, very smart, and very, very wise. And so just first, get a basic diet under control. Freddie, you're gonna ask me, well, what's a basic diet? The most important thing are your 5 fruits and vegetables daily. Everyone says, oh, but I always do that. No, you really don't. Studies show that 92% of people do not. But the goal is to eat 5 fruits and vegetables. You don't get the benefit of if you only eat 1 or 2 a day. You don't get a real benefit. You don't really get the benefit until you get to 5 fruits and vegetables a day. And for those people who may have cancer or think they have cancer, or for those people who are a little overweight, for 80% of that should be vegetables. Should be vegetables. But you've got to get your 5 servings consistently, daily, consistently daily, and you will decrease your risk of cancer, heart disease, strokes, diabetes significantly.
Wow, and I like that because this is going back to your conversation. Oh man, what did I do with my notes? Prevention is free, right? Like prevent like having a planned attack is free, right? I mean, it's gonna cost you some money for the foods, but but
Yeah.
having a strategic plan saying I'm gonna get my 5 fruits and veggies, that didn't cost
And I forgot this is your VIP crew, so they have money. So I can so let me just take it a step further. Look, Freddie, and Freddie's team. The most important thing you can do, next step, is when it comes to buying your fruits and vegetables, moving towards organic. Moving towards organic. And I'm someone 2 years ago, like, organic's fake. No, the pesticides and the herbicides play a humongous role. And so everybody's going to say, and I get it. I just went organic in the last year. The first couple months were difficult because it was expensive.
it. Yeah.
So I would encourage people, start off slow. And there are certain ones that should always be organic. And those are the ones that go directly into your mouth. Mainly, and then also according to the environmental group, they have a list of the like dirty dozen. Those are the ones they've tested. They're horrible. Don't ever, always buy those organic. But just to name a few of them, your berries, whether they're raspberries, your cherries, your blueberries, those should be organic. Your apples should be organic. Your leafy green vegetables should be organic. And for anyone over here, for anyone who says, I just don't have the money for it. So if you don't have the money for it, get it, put in a bowl, and put baking soda in there and let it sit for 15 minutes.
Baking
Rinse
soda?
it, baking soda, let it sit in baking soda for 15 minutes. That gets rid of, of the of the herbicides and the pesticides. Rinse that out, and then you want to put water in again, put the same fruit in there, and then put vinegar in there. That kills any bugs, and that gets you closer to being more organic. And by the way, non-GMO, genetically modified organisms is not the same as organic. It's not the same. They are completely different.
Yeah, ain't that something though? How the Food and Death Administration, as some of them say, right? Food and Drug Administration, I got all of these different like little labels that kind of trick us, like make us feel like it's organic or make us feel like it's better, and it's not. That's shameful. That's shameful.
And so this is a shameless plug. I would highly encourage people to follow me on Instagram because I'm doing a Women's Health Month series, and we're talking about these very things. What's the difference between organic? What's the difference between non-GMO? which should you buy? You can follow me on Instagram at Dr. That's Dr. Geoffrey Geoffrey and it's all about women's health. But in my studies, most about women's health also most of it applies to men too.
You said Dr. Geoffrey, MDH?
Oh no, Dr. Geoffrey, Geoffrey MPH, like Mary, Paul, Harry. That's a master's in public health.
MPH.
You follow me on Instagram, and if you look at some of the other ones, it's got some good stuff. I say it humbly because I research, and so the rest of the series is coming too.
Yeah, no, Dr. Geoffrey is super thorough, y'all. So make sure that you follow the brother. I dropped the link down here in the comments. We'll make sure we put it up on the actual video. Because I did want to spend the last few moments kind of talking about filling in those nutritional gaps, right? And I'm assuming that's what vitamins are for, right? And
Yeah.
then, of course, we
So,
got the Shield vitamins by Dr. Geoffrey. So kind of talk to us a little bit about this.
yeah, so thank you very much. I am the owner of Shield Vitamins, Black-owned company, Black research company, and so we have a number of different products. Again, shieldvitamins.com, and I'm not saying well, one of the most important supplements that anyone can take, especially, and it's okay for you to say this, especially if you're Black, is vitamin D. That's the most important supplement is vitamin D. And so I'm saying, you're saying, well, is he just selling that because it's on his website? It's on my website because of that. And so let me just tell you why it's just so important. Vitamin D plays a role in just about everything. Every single immune cell that we have has vitamin D in it. It plays a role in vitamin D deficiency leads to increased risk for insulin resistance, which is basically diabetes type 2, increased risk of depression, increased risk of heart disease, increased risk of cancer, especially prostate cancer. The list goes on. However, most of our vitamin D comes from being exposed to the sun. UV rays hit our skin and helps convert sunlight to vitamin D. However, the more pigment you have in your skin, the darker you are, the less efficient you are at converting sunlight to vitamin D. Wow. And so that's why 92% of Black Americans are vitamin D deficient. 64% of all older people are vitamin D deficient. I didn't say older Black folks, older people. Why? Because as you get older, because the skin changes that come along with like getting older, you're less efficient at converting sunlight to vitamin D. So I would highly encourage people to make sure that they take vitamin D regularly. And I'm like one more point. When you Google it, some of y'all should Google me now. I'm sure like Google it now. They're gonna say, how much vitamin D? It's gonna say 400 units to 600 units. That's based upon data from 20 years ago. That helps to prevent osteoporosis. People should be taking about 10,000 units per day. That's according to the American Endocrinology Association. 10,000 units per day. 8,000 units per day usually is equivalent to a blood level of 40 to 60. Above 40 is normal. You want to be close to 100. You say, well, why? Well, Geoffrey, if that's equivalent to normal, why are you telling me to take 10,000 versus 8,000? Here's why. When you take it, 100% of it is not absorbed. Especially if you have gut problems, it's not absorbed. So let me land my plane. If there's any vitamin you're going to take, if I were stuck on a desert island and God said, I'm going to give you one vitamin, I'm going to ask for vitamin D and I will be taking 10,000 units per day.
Okay, I got a question about that. One question is that IBUs or is there?
Oh yeah, IUs, international units.
IUs,
International.
okay.
It comes in it comes in micrograms and it comes in international units. I'm talking about international units.
Yeah, I'll be laughing because I got IBUs, some international bitterness units. That's beer. Like I'm a beer guy, right? I'm like, why is IBUs in my head like that?
My man, Freddie.
I like that hoppy beer, man. And then I'm telling on myself, but I'm just coming off of April. I did dry April, so I got beer on the brain, man. It's just early May. I'm gonna go get me some IBUs after this. But
And enjoy your beer. Recent study that came out, they used to say that alcohol may increase the risk. Now it's clear it does. It increases the risk for cancer. It's clear. So I'm not telling people, I'm not preaching saying stop drinking. But what the study
Ah,
also said that if you decrease it, you also decrease your risk as well.
I love it. I love it. Well, I just did the month. It was a good month. So,
My
and
man,
I'm going strong. So that's
my
good.
man.
Um, okay. And then somebody put it down in the questions down there. Oh, that's Tamiko. So is there a difference between vitamin D and D3? Like what is that?
So vitamin D, D4, D3, and D4. D4 is the most active form, but for all intents and purposes, it doesn't matter.
Okay.
Because so vitamin D is a fat soluble vitamin, which means that when you take it, it's not going to be immediately active anyways because it's fat soluble, so it's got to go through your fat cells and so forth. So you usually take 3 to 4 days anyways.
Okay. So just get you a form of vitamin D and you're okay. But 10,000 IBUs a day. I take 5,000 IUs. Let me erase this B out of here. 10,000 IUs a day.
Yeah, and I recommend gummies mainly because gummies taste better. And so what studies show there's increased compliance when like people say, "Oh, I get to take my gummy in the morning or in the evening." So taking gummies, that is the recommendation.
Seems to be better than pills, the people are
Yes,
asking.
yes.
Um, okay, so what other vitamins should be high on our list? So we got vitamin D. What other shield vitamins? Let's go all the way there. What other
So I was
shield vitamins should be high on our list?
So this is all tied to like gut health. So as Shield Vitamins, we have we have a probiotic to help keep your gut strong because again, gut matters. But I also think for those of us who have been eating poorly, going on a 15-day gut cleanse. At Shield Vitamins, we give you a 15-day gut cleanse. Let's clean out all that mess, reset it. Then you do your like probiotics, and then stress is a big cause of inflammation in your gut. Taking a little ashwagandha helps chill and relax you, lowers your stress level. When you lower your stress level, you decrease your cortisol level. When you have decreased cortisol levels, you have decreased inflammation. Again, all this is about decreasing inflammation. So, as you see, the drugs I choose or the vitamins I choose to develop is for strategic reasons. The company started off with immunity on purpose. Then we went to gastrointestinal health because we understand. And the next line is going to be a surprise, but we're going to be full circle dealing with matters that increase your overall health.
I love it. Okay, okay. Now I need you to go back on this one. Ashwagandha? I've never
Ashwagandha.
heard of this.
Oh, so ashwagandha, it's a natural herb. It is natural. Um, and by the way, I shouldn't keep highlighting that because everything natural is not good for you, but ashwagandha is. So it's a natural herb. You can take it twice, 3 times a day, depending on your amount. It decreases stress, decreases cortisol levels, and believe it or not, it also helps with mood as well.
Interesting. Okay, and that is on the site. Is
That's
that
on Shield Vitamins as well. You go to shieldvitamins.com, shieldvitamins.com.
okay? So like I hate to sound ignorant, Doc, but I just want to make sure. So when I go on there, I can click ashwagandha and like get that.
Yes.
Okay.
Yeah. And while you're clicking it, you might as well click. We have a mushroom complex, which helps with memory and gives you energy as well. Helps with memory, gives you energy, and believe it or not, it helps with workouts. It helps your body convert oxygen to the right level.
Interesting. Okay. All right. We got vitamin D, probiotics, ashwagandha, mushroom complex. What else we taking?
Oh, then there's vitamin C. Vitamin C is clear. Now we have a 6-in-1 immunity complex, and that's good. And this time of year when the viruses are back up, the 6-in-1 is key because it's got some elderberry, some echinacea, some zinc, and zinc is key because zinc help decreases viral replication. But what I love about the echinacea and the elderberry, it decreases inflammation. Don't forget, everything the goal is to decrease inflammation overall.
Now I know like this is good. This is good because in a lot of Black consciousness circles, I'm gonna bring up Dr. Sebi again because he talks a lot about reducing inflammation and mucus like being a big cause of problems in the body, right? So I love that. All right, what are any other type of gut health that we should be concerned about that's gonna assist us that you haven't mentioned?
I would say so. You asked me a question earlier. What can you do? So not only start eating right, meaning decreasing the hyper processed foods, but you can if you can eat your own natural probiotics, such as yogurt, Greek yogurt. That's a great probiotic. And I will promise figure out a way to eat some Greek yogurt, or even some sauerkraut, some kefir. Those are great probiotics. You're going to start to feel better within days.
I love it. That's good.
Ham
Like,
cheese. Yep, yep.
I got Greek yogurt in my smoothie here, Greek yogurt and
My
spinach,
man.
and apples and bananas and all that good stuff.
Yeah.
Organic.
Oh, good. Oh, wow, my man, already.
I did just converted myself. Like I'm like, hey,
When did you convert to organic?
oh, I'm partial organic, right? I'm organic adjacent. No, this probably this year. Like, ain't even no probably. Like this year, I've been intentional about buying the organic stuff, and and I'm looking at it like it's all expensive now. The prices of everything then just went through the roof. So I may as well it's literally a little bit more now because everything is high. So I might as well make the investment into the health.
Look, I love that. That is an investment. And my bill, I've got to be honest with you, I think my bill almost doubled, and so because I did everything organic. And so I started to learn some things I'm not. And hopefully your audience does not judge me, but my kids are coming home. They'll be home in a couple of days. I'm like, do they need to eat organic?
Hey, they still young. Y'all eat out of that side of the refrigerator.
I was going to do that, but I decided that I'm going to do the organic while they're home because I've noticed that when I adjust, like I don't drink water out of plastic anymore, none at all. And when the kids come home for like breaks, they like saw that. I noticed that they don't drink water out of plastic anymore, unless you're out and that's all you have. But I see they converted watching daddy. I said, so let me see, they will convert a little bit. So it's
All
going to be
right.
rough, but I'm gonna stick to it.
All right, all right. There's been a sister that's been on our calls that's been on me about my plastic water cups. I'm out. It's out of here. It's out of
He
here. I'm
nailed it.
converting to glass now, y'all.
Hey, you notice about what I've been drinking out of this glass.
I
Hey,
love
hey,
it.
no doubt, no doubt.
So I forget the sister name, but like on the events, like I'd pull my cup up and sip. She'd inbox me, and be like, "Get rid of that plastic." Like she kept saying that. Sorry. So I'm one of those hard-headed folks. So it takes a doctor to make me do something. So
Well, I'm
doctor,
glad that you did it. Thank you.
yeah. I threw my little cup, my favorite drinking cup too. All right, I'll get me another one. But I'll make sure that it's non-plastic. Well, while we're on that, why? Why? What's the issue with that?
It has BPA's. It has plastics. I mean, it has microplastic in it. And so some studies show that if you drink a bottle of water every single day, it's like eating two credit cards. And those plastics have forever chemicals in them. That means that they are there forever. And I do want to share with the audience, don't make if you try to make major changes fast, it's going to be difficult. I have tried that. I have done that. It's better to just do it slowly. And so even if it's small, for instance, I used to keep bottled water in my car during the summertime. The worst thing you can do, worst thing in the world, is to heat up something in plastic. So even in the microwave, worst thing, but also letting bottled water sit in your car where it heats up, cools down, cools down. So just take steps. And the first step I would take is organic. I would take GI health. I make sure I take my vitamin D, and make sure you write down a list of those 5 things for males, 5 things for like for like women, and get those scheduled. Just get them on the schedule so that at least they're on your radar.
I like that. This has been great, Doc. All right, so I want to open it up. Any of y'all have any questions for Doc? Just make sure that we can get your questions answered. You can raise your Zoom hand. I see a couple of comments or questions in the comments, Doc. Um, is this when our parents and grandparents used to give us the liquid cod liver oil in the winter? I think that was like during the vitamin D conversation. What do you think about cod liver oil in the winter? Is that like that's an old black thing?
Well, liver in general, is filled with a lot of nutrients. Filled with a lot of nutrients to the point where I was at the organic store and I was thinking about buying. I just couldn't do it. But yes, eating liver has a lot of nutrients. It has a lot of vitamin D and a lot of vitamin C, several of them in there.
Okay. What about K2? Someone is saying that they take K2 with their vitamin D3.
So that helps increase absorption, and that's great. But if you want to increase absorption of the vitamin D, if you eat it with a fatty meal as well, that increases absorption as well.
Good question. Kimchi? Someone mentioned kimchi. I'm not sure.
That's a probiotic. Very good. Very good.
Very good stuff. All right. So someone says, what if you have CKD2, chronic kidney disease?
Chronic kidney disease. Ask me more about if you have it, because we went through a series of conversations. Which part about that are they asking?
Yeah, Gregory, can you unmute and maybe just ask the question directly? You looks like you're unmuted, brother.
Yeah, I didn't hear what the doctor said though. He said,
yeah, he was just asking you to say more about it. Like, what exactly is the question?
well, the question is related to having CKD and taking vitamins. One of the reasons is because after speaking for myself personally, is that I did take all of my list of medicine and vitamins, and the doctor was shocked when I said, well, what I wanted to do was make sure that the nutritionist was talking to the neurologist who would have my vitamins. I mentioned the word Pharm D. She says, I said Pharma D. She said, it sounds like you've been doing your research. I said, yeah, because I want to make sure you all are talking to each other on the information that you're going to give me. She said, but what we do, she said, we don't bring them all in one room. She said, but I do talk to the pharmacists about your vitamins and everything. That's why I cannot talk to you right now. I have to get your list, and then I have another meeting with you. So that's why I was asking that question as it relates to your vitamins, because one of the vitamins that I was actually taking, and some of them, it was recommended that I don't take, but I spent a lot of money on it, and that was Andrew Lessman's. Yeah.
Yeah. So thank you very much, and thank you for being on top of your health. But based upon your comments, it sounds like you've got some seasoned experts that are on your team. And given that you have a unique situation, I'm actually going to hold off on making a recommendation. I would talk to the kidney doctor, because they will be able to advise you best as it relates to what form of vitamin D you should be taking. However,
no, they gave me my vitamin. They did do a blood test, and they gave me my vitamin D, telling me to take 4,000 IU a day.
Okay.
So I'm doing that. But what I was really interested in your vitamins, I can't think of the name, but anyway, that was the gut. I really like what you were saying about the gut, because I say that because when I started changing my diet, I had two side lumps that I've been trying to get rid of for years, and back pain. I mean, literally decades. But when I changed my diet, my bowel movement changed, and automatically those two side lumps went away, and my back pain went away. But this was decades, and I couldn't get rid of them. So I'm saying, well, how much waste was I walking around with, But my point is that not only that happened, I went down from 165 to 145 pounds. And so when I talked to the doctor, she said, well, if you cut out the sugar and you cut out the soda, she said, you were destined to lose weight.
She's right. And congratulations, because it sounds like you didn't diet. You just made some great eating choices that helped you. And I love what you said.
That is
if
what
you're talking about the side panels you're talking about, I had those two little side handles. I
was trying to exercise, and but once I started going to the bathroom daily, at least, I would go, if it's okay, that maybe once or twice a week. But now daily, and I said, man, I started going, instead of hitting that hump, I go straight down. I said, wow. But I also lost weight. But when I lost that weight, I was concerned, because I went from 165 to 145, and the doctor said, well, you were destined to lose weight based on your life change. And that's why I was making not just the diet change because of the CKD, life changes.
Well, Mr. Norris, I thank you for getting on because what you've just given us is a testimony, which is just with some sudden adjustments, some small adjustments, your body will naturally lose weight. It will naturally revert to its normal state. And I bet you didn't comment on it, but I'm willing to I bet that you even feel better. I can tell by
Yeah,
your
it was
energy.
crazy. It was,
Yeah,
yeah.
yeah, and mention your bowel movement, say once or twice a week, daily, and so what that also means, you're getting rid of a lot of toxins. And so when you have a buildup of toxins, it increases your risk for a whole lot of things. So your daily bowel movements are helping you get rid of toxins as well. So congratulations.
But I was interested in your gut clean, because that was my.
Well, this is what I would say. So, because I'm a provider before I'm a businessman. That is, I would hold off only for you, not for everybody else. Hold off on hold off on the gut cleanse and run it by your primary care doctor. Run it by your kidney disease doctor.
I see them the 6th of
Okay,
this
good,
month.
good. So you can pull up the site and they can look at it. And before anybody says, well, I may have kidney disease, if you've not been diagnosed with it, you probably don't have it. 99% of Americans don't have it. But given that we know you have it, let's be safe, especially since you're doing so well. Pull up the site on your phone, run it past the kidney doctors, and bam, if they say it's good, my man.
I love it.
Thank you.
Excellent, excellent. All right. Yeah, Doc, real quick, I wanted to ask, what exactly is the 15-day gut cleanse and how do they get it on your site? Is it like a sign up or purchase?
Oh
Like
no,
what?
it should be on the site now. Please don't tell me it's not. It's on the site. It's you just go to order it. It's pills. It cleanses you very, very well.
Okay.
And so that is a good start. And again, I would say that I would love for you to buy that, but the vitamin D is key. And you know, full disclosure, everything that everybody sells most of the time, there's a natural form of it. So if you want to do your own gut cleanse at home, there's a way of doing that as well. If you want to increase your own bacteria, there's a way of doing that as well. But the first step that would help everybody on this is that increase your water intake. Increase your water intake is going to increase your mood. It's going to increase your immunity. It's going to decrease your stress. It's going to help you sleep better. And I said again about at least 16-ounce 4 to 6 16-ounce bottles of water a day. I'm sorry, that's for women. For men, it's 8 to 10 16-ounce bottles a day of water. That's just regular old water.
I love it. I love it. Just got a few more questions. First of all, Nicole said it's on the site. She's on the site viewing everything, so it is
Put
there.
Nicole on there. I like Nicole.
Yes. All right. Tamiko got a question. What about fatty liver? What should we eat for that?
Oh, fatty liver. Tell me more about what you're asking.
Tamiko, is that you? I think that's you.
No,
No,
that's
hold,
not me.
Okay, that's
Oh,
good. It's good that it's not you because now I can answer that. Good, it's not you. So there's two common causes of fatty liver. It's drinking too much alcohol and drinking and eating too much hyper processed foods. It's so two forms. So one of the best ways of doing it is to detox your liver, detox it regularly. And so I don't know if you have a juicer or you have a blender. This is what I recommend. I'm not going to have the mounts because Freddie didn't tell me about this part, but I can tell you the ingredients. You want to make sure you put spinach, ginger, turmeric, kale, about 5 radishes, pepper, because whenever you use turmeric, you got to add pepper to it. And there was one more. Lemon. Mix that, and you want to eat that. And you can Google and look up. I mean, you can go to Chat GPT and look up the amount. But that's a liver detox. You only want to do it once or twice starting off because you will feel that. You will feel that. And it works better if you do it on an empty stomach. So do it in the morning and try to wait till your first meal of the day. I mean, try to wait a few hours before you eat your first meal. But back to the question about a fatty liver. Changing your diet will help with that. Decreasing the alcohol intake will help with that as well.
Okay, that's good. Look, I had to take those notes. I was like, I did my month alcohol cleanse, but I'm like, oh well, that good old liver can use some assistance too. So I think that's good. I'm on my juicing thing, so I'm excited about that. Someone said milk thistle for detoxing the liver? Question mark.
I use milk thistle myself. However, I don't use it for detoxing of the liver. I've heard the milk thistle's good. That's just not what I use it for.
Okay. I'm taking castor oil and Cascara Sagrada to help with waste removal.
I don't know much about that. If you
Mm.
looked it up and it's working, and keep it the good work.
See, if it's working, right? Let's see. Years ago, I was shocked to find out that in the Bible was the word inflammation, and it was harmful in our bodies. I always remember this years later. This conversation is bringing it all back. All right, Angela, that was interesting. Yeah.
And that was good because, as I said, if you don't leave anything else from this conversation, the goal is to decrease inflammation, decrease inflammation. And if you smoke, I know that's passe these days, but that includes weed. If you smoke weed, that causes inflammation too. And one more just big point about weed. Freddie, are you aware that when you smoke weed, it increases your chance of a heart attack by 5,000% the first hour after smoking weed?
What?
Yeah. So it's not uncommon for a 25-year-old to have a heart attack. Usually when a 25-year-old had a heart attack and they didn't have a history of heart disease, it usually was cocaine or methamphetamine. Now what we're seeing is that weed, people who smoke weed, and people are gonna say, why? Because I don't know how old people are, I'm assuming you're really young, but back in the day when I was coming up, the street weed, it had about 4 to 5% THC. The weed today may have as high as 94%, and that's legal weed.
Wow. That's something else right there. Okay. All right, y'all got any other questions for Doc before I let him get on out of here? Now, all right, going once, going twice.
Freddie, I would like to just jump in there. Dr. Geoffrey, I just want to say you were remarkable today because, I hate to say this, but there's so many doctors that have no understanding of the importance of nutrition. And because I know you guys don't, it's not a requirement that you do more than a certain amount of hours on it. So, hats off to you with your knowledge on that and getting the word out, especially to the Black community. So we really do appreciate you. You are amazing.
Thank you.
Yeah. All right, yeah, Doc.
I
Thank
appreciate
you.
it. Thank you.
Thank you, Tamiko.
And the caller's right. Just so your providers don't read up a lot on the nutritional aspect. And full disclosure, vitamins, I do a lot about that. I do a lot. When you come to me as an ER patient, I'm not talking nutrition and vitamins. You having a heart attack, I'm not talking any of that. I'm full modern medicine. But yes, the nutritional aspect of health, that plays a humongous role as it relates to disease.
All right, one more question. All right, Angela, I dropped the links to the liver detox for you or the ingredients. Karen asks, is drinking hot water from a metal thermos okay? And then second question is CMOS good to take?
I don't know what a metal is. So could you educate me, Freddie?
Oh, a metal, like a thermos, like you got your
thermos.
Yeah, metal thermos.
Oh, absolutely. Oh, drinking water, absolutely. So metal, glass are just fine. Forgot the rating, but there's a certain type of like metal, but it's better to use regular over-the-counter metal than it is to use any bottled water. And by the way, bottled water will fool you. It would say BP. It doesn't have BPA. It has BPB. And so they say no BPA because everybody knows about BPA. BP anything is bad. BP anything is bad. So stainless steel is just fine. And actually, just real quick, let me say the 5 things you should get out of your kitchen. 5 things that you should get out of your kitchen. Number 1, which the dishwasher pods, the regular dishwasher pods, you should change those to organic because the pods they use a layer. They leave a layer over the plates and the dishes that is toxic to. I mean that is carcinogenic to you. Anything in your refrigerator, and it takes time, that comes in plastic. Usually plastic is bad. If it comes in plastic, probably don't need it too. Then you want to get rid of non-stick pans. Non-stick pans. Get rid of those. Those are full of carcinogens. Then dishwashing detergent. There's an organic version to that as well. There's an organic version to that as well. And I'm finally having a senior moment. What's the 15? What's the 15? What's the 15? What's the 15? Oh, your chopping boards. Those should be wood, not plastic, because with that wood, I mean, because of the plastic, it has BPA, phthalates, a lot of carcinogens in it, or hormonal disruptors.
Man, Doc, this has been awesome.
Brother, I'm gonna call you out. You know, I'm gonna tell you all. Can I just open up to you all about Freddie? I've been trying to come. I've been trying to be a guest for a long time. I've been trying to be a guest for a long time, and finally he let me on the show.
Oh, y'all know. Doc is busy. He's speaking all around the country. You know, he's running ERs and selling vitamins and all this good stuff. He's a busy brother. So
no, Doc, you're telling the truth, because we've been trying to open Freddie's Rolodex, and he's finally allowing us to pry it open. So
That dude has an extensive Rolodex. Don't be fooled. Yo, that dude is famous. He's got an extensive Rolodex. Oh no, ain't no joke.
Hey,
that's right.
Let me mute Tamiko. Hold on. Like, you're on my side. Like,
I am, but I had to agree with Doc on that one. I had to let him know he was telling the truth. So yeah.
Doc always.
I do have a shameless plug. My next book is coming out. It's called Fast Decisions. Think fast, be bold, and be fearless. It teaches people how to make fast decisions. It focuses on increasing confidence, mindset, and overcoming fears. It's a fast-moving book. It has a lot of real ER stories, a lot of real-life examples. And so I would highly encourage that comes out on May 28th. The last 3 books have been bestsellers. I'm trying to make this one not only a bestseller, an international bestseller as well. Hopefully, the link is not ready. Hopefully, I'm gonna send it to Freddie. He'll put it in the group. But I really appreciate it.
Yeah, no, we definitely do that. What's the best way for the people to follow you? We got the Shield vitamins. We got your Instagram. Is there another way or a better way?
Sure. They can follow me on Facebook at Geoffrey. That's Geoffrey Mount Varner, Mount Varner, V like Victor, Arner. And so that's the best place to follow me as well. But I'm most consistently, for the newest data, it's Instagram, and the Instagram is attached to my Facebook.
Okay, excellent. So we got that. I got all of the links. I'm dropping them down there in the comments, and I'll definitely drop Shield vitamins one more time. Okay, I guess I need to hear this recorded again. They already want to record. All right, just in closing, good brother, we got your follow-up information. Just leave the people with some last and final thoughts.
I'm gonna leave you with some final thoughts, and please share this with other people. What we do know, this is fact, is that 42% of the people, 42% of us will get cancer. Fact. 42% of us will get cancer. 100% of us will know someone who has it. We are also aware that 70% of cancers are caused by environmental factors, mainly our diet. And I hate to end on this solemn note. Chances are someone on this call has cancer and don't even know it yet.
Wow.
But here's a shout out. You can slow your cancer, stop your cancer, and in some cases even treat your cancer by changing your diet right now. And for those of you all who don't have it, that will eventually be diagnosed with it, changing your diet now plays a humongous role. Freddie, just give me two technical minutes. Let me give you an example. One way the cancer works is it disrupts the communication between cells. It disrupts the communication. Cells are able to grow. There's an enzyme called connexin. It disrupts that. However, studies show that if you eat parsley and celery, it keeps that communication going. So even if cancer wanted to come, because you've been eating the parsley and the celery, you significantly decrease the risk. And there are numerous examples of that if you eat a certain way, it decreases your risk of cancer. And some of you already know the cancers you are at risk for. So adjust your diet now. And again, let me land my plane. Leafy green vegetables are key. The berries, strawberry, raspberry, blackberries are key. Garlic, turmeric, and ginger. Oh, yeah. Garlic, turmeric, and ginger. They should be part of your daily meals, daily. And so if you just adjust in those different ways, you will significantly decrease your risk for cancer, heart disease, obesity, and strokes.
Wow. Wow. All right. Well, that was a heck of a way to go ahead and end out. I definitely, yeah, we definitely appreciate that. Well, thank you again, Dr. Geoffrey, for gracing us with your presence and your insight, your knowledge, and your information. We definitely appreciate you for coming by and being on Sankofa Speaks. So thank you, good brother. We definitely appreciate you. Everyone, thank you. Please take a moment and unmute and just go ahead and blurt out your appreciation for Dr. Geoffrey spending
so
this
much.
time.
This was very informative. I needed it. Thank you. Blessings to you. Thank you.
Good. Thank you. Thank you very much. Thank you very much.
Incredible. Incredible as always.
Yes.
Thank you so much, Dr. Jeffrey. This
You're
is
welcome.
the
Thank you
flower. Thank you.
very much.
I
Thanks.
appreciate it. I appreciate it.
It's awesome to even hear from your own and to know that you're being taken in consideration with the delivery as it relates to your focus on Blacks. Thank you.
Thank you very much. I appreciate that.
Yeah. All right, good brother. Well, thank you, man. I appreciate you spending some time with us. And thanks again, man. Just always.
Right, it doesn't need to be 2 years again or 3 years. It don't need to be 3 years. The hate is real, everybody. The hate is real. It's been 3 years.
No, I only try to I try to ration the doc out because he an alpha, and you know that how that goes.
Freddie, because I love your brand, I love what you do for the community, I'm gonna put you on blast. Anytime you need me, anytime, just like Tamika, I had to cancel yesterday because the ER, I made sure I was on there as soon as possible, right or wrong.
Yes, yes, you did. Yes, you did.
Yes, you did. Yes, you did. I always appreciate you, Doc, man. Thanks a
All
lot.
right, you all be well.
Yeah, peace and blessings, my man.
Thank you very much. Bye-bye.
Bye, brother. Yeah, so for everybody else, I appreciate y'all being here and hanging out. I got a couple of quick announcements.